This is Max from UNFTR for MeidasTouch. And look, I don't traffic in hysteria, but now that the dust has settled from the GOP budget bill, there are new healthcare studies that were just released that show how catastrophic it is for the United States. So here's the upshot. Healthcare in the United States, best in the world, if you can afford it. Health coverage in the United States is the worst in the world, if you can afford it. These are the first and last lines of the story, and our job today is to fill in the blanks in between with a sense of urgency, because these new studies reveal how the Trump administration's budget bill is likely the final death blow to a system that's already teetering on the edge. Now, fair warning, this is a lot. It's a lot of information, it's a lot of terrible news, and if you live in the United States, it absolutely affects you, no matter what. So if you get your health care from the government, or from the ACA exchange, your employer, doesn't matter. There are only two guarantees come next year when it comes to healthcare. You're either going to lose your existing coverage or you're going to pay a lot more. So here's how we're going to break it down. I'm going to show you the areas that are most affected and why. Then I'll explain how we got here and how it was never supposed to be this way and whose fault it is. And there's some real surprises in that one. And then I'm going to show you how there's literally only one option moving forward and how it is the cornerstone of the plan to revitalize the Democratic Party. Because it always was. So let's go. Okay, let's start by acknowledging that the American healthcare system is already in crisis. Outcomes not better than peer nations, and in some cases far worse, despite the fact that we have the highest cost of coverage and, as you can see here, the second highest out-of-pocket costs in the world. So while we're going to go through how the new GOP legislation is about to destroy the fragile healthcare ecosystem starting in 2026, it's important to be honest about our starting point. Literally every sector of healthcare coverage is going to be affected.
Nearly 12 million Americans are expected to lose health insurance with this bill. That includes almost 2 million in rural areas.
Now to a serious concern for the more than 24 million Americans who get their health care through the Affordable Care Act, also known as Obamacare. According to an analysis by the research group KFF, people who buy insurance on healthcare.gov or state-based marketplaces could see the price they pay increase by an average of 75% starting in January 2026.
If you get health insurance through your work, prepare to pay a bit more for it next year. According to a new report, employers are planning on shifting more healthcare costs onto their employees. The report released by Mercer said more than half of employers plan to adjust their healthcare offerings in 2026.
So it doesn't matter if you get your insurance on the exchange, from the government, or from your employer, costs are going up a lot. That's the takeaway from the GOP approach to healthcare, which is all rooted in this promise.
We as a party must fulfill that solemn promise to the voters of this country to repeal and replace.
Ascribing blame can be satisfying. But once again, we have to be honest that the blame is spread far and wide when it comes to the system we currently have. But there's no question that the Republicans' tear it all down strategy is going to cause undue and unnecessary pain for the vast majority of households in America. And they have neither a plan nor any intention to solve the crisis. See, to them, it's as simple as make more money or just don't get sick. And that is the sickest thing about this whole thing. This also means that Democrats have the opportunity of a lifetime to finally see the solution that has been staring them in the face for more than 6 decades. Okay, so we're going to witness the biggest healthcare crisis in decades, and it's entirely manufactured. Right now, as we speak, millions of Americans are losing their Medicaid coverage due to the draconian work requirements embedded in what Republicans euphemistically call that big, beautiful bill. But here's what they don't want you to know. This isn't just going to hurt the people who lose coverage. It's going to devastate everyone. See, when millions of people get kicked off Medicaid, state budgets don't just magically fix themselves, because that's where the federal government steps in to supplant and support the revenue required to provide Medicaid coverage. So states are going to scramble to fill the gap, and guess what happens next? The entire private insurance market gets slammed with higher costs because it reduces the risk pool required to make insurance affordable. We're already seeing insurance companies request premium increases of 15% or more for 2026, the largest increases that we've seen since 2018. And that's before the full impact of these Medicaid cut hits. This is the perverse reality of building a healthcare system around private insurance and employment-based coverage. When one part fails, the whole rickety structure starts to collapse. And the people who suffer? Working families, small businesses, and anyone who dares to get sick in America. But here's the thing. This crisis could be the catalyst for the solution we should have implemented decades ago. Because while other developed nations figured out long ago that healthcare is a public good, not a profit center, we've been trapped in a system designed to extract wealth, not deliver care. Private healthcare markets are built on fundamentally perverse incentive structures. You can't have a system designed to help people stay healthy, which requires fewer medical interventions, when the same system is designed to generate profits from more care and expensive interventions. So like if the fire department made money every time they put out a fire and their jobs depended on it, there'd be a lot of arsonists in the department. But we don't even need that ridiculous hypothetical scenario to drive home the idea of perverse incentives. Just take the private prison industrial complex that thrives on recidivism and punitive laws for minor offenses that put people behind bars for less and for longer. Or a healthcare system that incentivizes insurers to deny claims and providers to make as much money on everything from routine visits and prescription drugs to hospital stays. That's why every other developed country on planet Earth treats healthcare as a central government responsibility. It's not a fringe progressive idea. Private insurance is the fringe idea, and we're about to see exactly why it's failing so spectacularly. The American healthcare system isn't some grand design based on careful policy analysis. It was an accident of history that we've been too stubborn to fix. See, during World War II, wage freezes meant employers couldn't compete for workers with higher pay, so certain ones, most notably unions, started offering health benefits instead. So what began as a wartime workaround became the foundation of the entire system. So fast forward when Lyndon Johnson created Medicare and Medicaid in 1965 as part of the Great Society, it was supposed to be the beginning, not the end. Medicare and Medicaid were designed as the first steps toward universal coverage, a way to prove that government-run healthcare could work by starting with the most vulnerable populations, seniors and the indigent. So the plan was to gradually expand coverage to everyone, but the implementation costs initially were higher than expected, and political resistance was huge. Believe it or not, it was the AMA, the American Medical Association, that fought tooth and nail against it, convinced that government involvement would destroy the profession. Now, they were wrong, of course. Medicare became wildly popular and extremely efficient, but the damage was done. The momentum for universal coverage halted for a while. It would be years before we had another shot under Jimmy Carter. And Ted Kennedy was pushing hard for a comprehensive national health plan, but the relationship between Kennedy and Carter and the economics at the time were so toxic and so brutal that they just couldn't get it together. It was a little bit of Democrats eating their own moment when personal politics killed what could have been the moment that we joined the rest of the developed world in treating healthcare as a right. But once Ronald Reagan took office, the window closed completely. The Reagan era ushered in the philosophy that government is the problem, not the solution, and private markets can solve everything. In the healthcare industry, smelling opportunity began its massive expansion. So insurance companies grew larger and more powerful. Hospital systems consolidated. The pharmaceutical industry discovered that it could charge whatever it wanted. So instead of a rational system designed to keep people healthy, we built a labyrinthian extraction machine designed to generate profits over and over, and we've been living with the consequences ever since. So this employment-based system creates huge vulnerabilities. When people lose their jobs, they lose healthcare. When companies can't afford rising premiums, they cut benefits or they drop coverage entirely. We need elaborate safety net programs like Medicaid precisely because our primary system is so unreliable. But here's the irony. Every time we try to patch the system with safety net programs, conservatives complain about government spending and dependency. But they've created a system that requires government spending, government intervention, and dependency. They complain about all of this stuff, and it's maddening because it doesn't make sense. Now, the next major attempt at healthcare reform came under Bill Clinton in the early 1990s. Now, recall that it was actually Hillary Clinton who led the charge, developing a comprehensive plan that would have provided universal coverage while maintaining a role for private insurance. It was a complex Rube Goldberg kind of system in retrospect that looked a lot like Obamacare. Now, the response, of course, was swift and brutal. Newt Gingrich and the Republican coalition in Congress launched an all-out assault on the whole plan, painting it as government overreach and socialized medicine. The insurance industry spent millions on those infamous Harry and Louise ads, which you can still find on YouTube, featuring a couple worrying about government bureaucrats coming between them and their doctor, while completely ignoring that the insurance company bureaucrats were already doing exactly that. So when the Clinton plan died, with it any hope of meaningful reform for another generation, it wasn't until Barack Obama came into office that he tried again. And he forced the same basic concept: push for universal system while working with private insurance companies. So the result was the Affordable Care Act, as we now know, but that plan, ironically, was originally developed by the Heritage Foundation and implemented by Mitt Romney as governor of Massachusetts. And if Heritage Foundation sounds familiar, they were the lead sponsor of Project 2025. Now think about that for a moment. Obama's signature healthcare achievement that the GOP has been trying to kill since it came into existence was based on a conservative think tank's plan designed to preserve the private insurance market while forcing people to buy coverage through mandates. And it was literally designed to avoid creating a government-run alternative that might compete with private insurers. Now listen, the ACA did accomplish some significant things. It brought millions of people into coverage through the exchanges. It expanded Medicaid in most states. And it eliminated some of the worst practices of insurance companies, like denying coverage for pre-existing conditions. These were genuine improvements that saved lives and prevented bankruptcies. But the fundamental structure remained intact. We still had a system designed to generate profits, not health outcomes. And predictably, costs continued to rise. Insurance companies found new ways to extract profits. They raised deductibles, narrowed networks, increased out-of-pocket costs. Pharmaceutical companies continued their relentless price increases. Hospital systems kept consolidating and raising prices. So the ACA slowed the rate of cost increases for a while, but it couldn't solve the underlying problem. When your system is designed to maximize profits rather than outcomes, costs will always go up. You can't regulate your way out of a fundamentally misaligned incentive structure. Healthcare providers, now guaranteed more paying customers through the exchanges and Medicaid expansion, had every incentive to raise prices. They knew insurance companies would pass those costs on to patients and taxpayers. The ACA essentially guaranteed a larger customer base for an already dysfunctional market. From the moment the ACA passed, the Republicans made destroying it their mission. They voted to repeal it over 60 times in the House. They challenged it in the Supreme Court multiple times. They refused to expand Medicaid in their own states, their own red states, leaving millions of their own constituents without coverage just out of spite. And when they finally gained control of the government in 2017, remember that they came within one vote, John McCain's infamous thumbs down, of repealing the entire law without any replacement. Think about that. They were willing to throw 20+ million people off their health insurance with no alternative just to score political points. When outright repeal failed, they shifted to death by 1,000 cuts, so they eliminated the individual mandate penalty. They weakened enforcement of insurance regulations, created junk insurance plans that provided virtually no real coverage. They sabotaged the system that they couldn't destroy, and eventually knowing that it'll happen anyway. The COVID pandemic provided a brief reprieve, with the Biden administration enhancing the premium tax credits that make coverage more affordable, and enrollment in the exchanges as a result surged. And millions of people gained coverage just for a moment, and it looked like the system might stabilize as a result. But the cost kept rising. Despite more people joining the insurance risk pools, the insurance companies continue to raise premiums. Why? Because the fundamental incentive structure hadn't changed. More customers just meant more opportunities to extract profits. And the profiteering became increasingly sophisticated. Pharmacy benefit managers, we did a whole big story on that at UNFTR. These middlemen who were supposed to help control drug costs became massive profit centers themselves. I mean, the three biggest PBMs took in over $600 billion in 2023 alone, and that's only gone up since then, by manipulating drug formularies to maximize their own profits. And then they started gobbling up and playing Pac-Man with even some of the providers and some of the outlets. Insurance companies developed algorithms, as we know from Luigi, to automatically deny a certain percentage of claims, knowing that most people won't appeal. They created networks so narrow that patients often couldn't find in-network specialists. They raised deductibles so high that people had effectively no coverage for anything but catastrophic events. The result is complete and total national anxiety, with 2/3 of adults saying that they're worried about being able to afford the cost of healthcare. 41% of American adults currently have medical debt. 1 in 4 people say that they or a family member had problems paying for healthcare in the past year. And about 1/3 of adults have skipped or postponed needed care because of the cost. Even among those with coverage, as you see here, the numbers are already off the charts. I mean, $32,000 a year for family coverage and $7,000 for individual coverage? On no planet do these numbers make any sense. It's unsustainable for literally everyone involved. So this isn't a healthcare system. It's a wealth extraction scheme with medical care as a side effect. So we're about to see this dysfunctional system pushed to its breaking point, because the new KFF analysis makes it crystal clear. Healthcare costs are going to explode beyond anything we've seen in years. Insurance companies are requesting premium increases of 15% or more next year, the largest increases in years, but that's just the beginning. See, when the enhanced premium tax credits expire at the end of 2025, out-of-pocket premium payments for subsidized enrollees will increase by over 75%. And here's where the cruel math of insurance markets kicks in. When premiums spike, the first people to drop coverage are the healthy ones who figure they can risk it without it. So that leaves the insurance pools with sicker, more expensive patients, which drives up costs in an ever-increasing vicious cycle. So there's all the bad stuff that I promised you was coming. But there is a good thing about this moment, in that it finally puts everything in black and white. See, sometimes it's hard to change something that still works a little bit, or when it's the way we do things around here. Sometimes a thing just has to die for something new to take its place. And that's why I chose this as an opportunity instead of just viewing it as a crisis to end all crises. Because while Republicans and their corporate donors are busy destroying what little healthcare security Americans have left, there's a solution that's sitting right in front of us, and it has been for decades. It's called Medicare for All. And it's not some radical leftist fantasy. It's just common sense. Every other developed nation has figured this out because they've recognized a fundamental truth that we seem incapable of grasping. Healthcare is a public good, not a market commodity. And guess what, DNC? Americans have figured that out too. The only reason we're not all talking about it is because you're not letting candidates campaign on it, and the corporate media won't acknowledge it. So this is the latest Economist YouGov poll. And The Economist isn't exactly a liberal source, and it shows that 59% of Americans support Medicare for All, while only 29% oppose it. And 14% are undecided because they haven't heard enough about it. But think about that. The only person who made national headlines talking about Medicare for All as a real possibility in recent memory was Bernie Sanders, and his campaign feels like 1,000,000 years ago at this point. And the numbers are consistent, by the way. They've been like this for years, despite the fact that neither party will formally support it and no public media outlet will talk about it. So this isn't wishful leftist thinking. This is literally the will of the people. Let's look at it again. If you look at who's contributing most to the opposition, and this will shock nobody, it's white men above 65 years old in the highest income brackets. People who already have Medicare and can afford the out-of-pocket expenses that come with it. I mean, talk about closing the door behind you. So the two main arguments are typically that we can't afford it and that the private market always distributes benefits more efficiently than the government. Well, allow me to destroy the latter in one sentence. Administrative costs for Medicare are around 2%, whereas administrative costs for the entire private insurer market is around 13%. Now, to the former point, in that delta, there's hundreds of billions in savings. See, when the government is the single payer, administrative costs plummet. Medicare for All isn't just more efficient, it's way more effective. See, when everyone is covered under the same system, there's no need for the army of administrators whose sole job is fighting for insurance companies over claims. Doctors can focus on practicing medicine instead of navigating bureaucratic mazes. The most recent comprehensive study by Ken Lefkowitz found that Medicare for All would save between $500 and $600 billion annually, while covering everyone. The University of Massachusetts came to the same conclusion. Yale, same. The Annals of Internal Medicine, same conclusion. So the we can afford it argument is right there. But there's still the issue of the people who are currently employed in the insurance industry and the benefit management system who would be displaced, and that's a real thing. Well, the latest Medicare for All bills, introduced a couple years ago by Bernie Sanders and Pramila Jayapal, include specific provisions to protect displaced workers, setting aside a certain percentage of the budget for 5 years to provide wage replacement, retirement benefits, job training, and priority hiring. On UNFTR, Medicare for All is a key part of what we call the 5 non-negotiables of the left, and we pair it with a civilian labor corps that can take the non-private industry jobs that will be in desperate need in our economy, like childcare, senior care for aging boomers, environmental protection and resilience, and the like. So this is the kind of broad policy thinking that we need to see from Democrats to transition not just our economy, but account for an aging population and a dwindling workforce due to AI displacement, general mismanagement, and a determined effort on the part of Republicans to impoverish tens of millions of Americans while building a moat around the wealthy. Again, this is not a fringe progressive issue anymore. The current system is failing so spectacularly that Medicare for All has become a moral, fiscal, and medical imperative. And Democrats need to understand that this is a winning issue that can rehabilitate the party and bring it back to its roots. Remember, Democratic polling is below Republican polling. That's the favorability ratings of Democrats right now. I mean, talk about a party in search of a mission. Healthcare is a right. It's not a privilege. It was central to LBJ's Great Society. It was Ted Kennedy's life's work. It's who we are as a party, or at least it should be. Administrative waste is bleeding our economy dry. Medical bankruptcies are destroying families. People are dying because they can't afford insulin or cancer treatments. Meanwhile, insurance company executives are getting rich denying claims. Pharmaceutical CEOs are buying yachts with the profits from jacking up drug prices. Medicare for All would eliminate all the perverse incentives that drive up the costs. See, when the goal is keeping people healthy rather than maximizing profits from their illness, the entire system functions differently. Preventive care becomes a priority because it's cheaper. It's cheaper than treating advanced diseases. Drug prices are negotiated nationally instead of being set by corporate price gougers and all those PBMs in the middle. More importantly, healthcare decisions are made by doctors. Doctors and their patients, not insurance company bureaucrats whose bonuses depend on denying care. The only people who lose under Medicare for All are the shareholders who who've been profiting from human suffering. Insurance company executives might have to find honest work. Pharmaceutical companies might have to price their drugs reasonably. Hospital administrators might have to focus on patient care instead of maximizing profits. The bottom line is, even if you're a conservative originalist, healthcare is a public good. It's part of the general welfare of the nation. And public goods are the government's responsibility. That's not just good policy. That's a basic constitutional principle. The preamble in the Constitution specifically mentions promoting the general welfare as one of the fundamental purposes of government. Adam Smith, the supposed founder of free market capitalism, he understood this. He wrote that there are certain functions of society that cannot be left to private markets because the profit motive creates those very same perverse incentives that we've been talking about. And healthcare is the perfect example. Democrats just need the courage to learn the numbers, to understand the issue, to do the research. There's no one better than the Meidas Mighty to bring that message directly to their own constituencies and their own candidates and their own representatives. We need to teach a lesson to the lobbyists and the dark money groups that we have the power, not them. And the evidence is overwhelming. The moral case is clear. The political benefits are tremendous. Medicare for all's time has finally come. The question is whether Democrats will fight for it or just keep tinkering with a system designed to fail while Americans die from ration care and medical bankruptcy. Now, we've been working on healthcare for quite some time, so in our MeidasMax recommendation section on bookshop.org, I've put together a couple of my favorite books on the matter. I'll leave a link in the description. So I hope this inspires conversation in your household and offers a glimmer of hope in these dark days that the solutions are out there. And you're not alone in demanding better for our country. And I appreciate you indulging in the conversation, and I look forward to hearing from you as well. For the MeidasTouch Network, I'm Max from UNFTR. Don't forget to follow us on YouTube and on Blue Sky at UNFTR and to sign up for our free weekly newsletter at UNFTR.com. Thanks to the Mycelis brothers for the platform and to the Meidas Mighty for hanging with me today. I'll catch you next time.
Can't get enough Meidas? Check out the Meidas Plus Substack for ad-free articles, reports, podcasts, daily recaps from Ron Filipkowski, and more. Sign up for free now at MeidasPlus.com.